Greetings to Doctor. We are from Group 1, consists of me, Chiyong.
Bibi, Chen.
Today, our group is going to demonstrate and explain the procedure of measuring range of motion RF for shoulder and elbow. Before we start the measurement, let's make a short introduction about range of motion. ROM refers to available amount of motion in the joint, and it is measured using goniometer. It can be classified into active range of motion, passive range of motion, active assisted range of motion, and active resistant range of motion. The goniometry data is important to determine the presence of joint impairment and also help physiotherapists to track the effectiveness of the treatment. So, it is important for a physiotherapist to master this skill. Now, let us get started.
Good morning, sir. I'm Chen, a Year 1 physiotherapy student. How can I address you?
You can call me Yong.
Okay, Young. Today I'm going to measure your range of motion of your upper limb. So we will start with shoulder flexion. Before we start, you have to ask patients to remove their shirt and expose their pressure pad properly. Sir, may I have you to expose your body by take off your shirt?
Okay.
And we have to ask consent from the patient too. Young, throughout the process, I might have physical contact with you. Are you okay with that?
Yes, okay.
So we will ask patient to lie in a supine lying position. Young, can you please lie on the bed by facing upwards?
Yes,
Is this position comfortable for you?
yes.
Before measuring the range of motion of shoulder flexion, we have to perform PROM on the patient. So we have to stabilize the proximal part of the shoulder and perform PROM. The stabilization is to prevent the spine extension. So after we knowing the end feel of the patient, we'll put back to original position. Now we have to palpate the bony landmarks to align the goniometer. The axis will be at the lateral aspect of acromion. The stationary arm will be parallel to the lateral aspect of thorax, and the moving arm will be at the lateral aspect of humerus towards the lateral epicondyle of humerus. So now, Young, can I have you to perform the action just now by yourself?
Yes.
So we have to perform stabilization to prevent spine extension of the patient. Now we have to palpate again the body landmarks and align the goniometer. The reading for the first measurement is 170 degrees, and we have to repeat 3 times and take the average to do the documentation. The range of motion of shoulder flexion of the patient is 170 degrees, which is within the normal range of motion 0 to 100 degrees. So now we'll proceed to the shoulder abduction. So before we start, we have to perform PROM on the patient to determine the end feel. So here's the end feel, and we have to put it back to the original position. So to align the goniometer, we have to palpate the bony landmark of the shoulder abduction. The axis will be at the anterior aspect of acromion. Then the stationary arm will be parallel to the sternum, and the moving arm will be at the anterior midline of humerus towards the medial epicondyle of humerus. So now, we'll ask the patient to perform ROM by themselves. Can you perform the action just now by yourself? But I will stabilize your shoulder to prevent lateral trauma action. Alright. So you can put back to original position. So the reading will be around 140 degrees, which is within the normal range of motion, 0 to 180 degrees. And now we'll proceed to the shoulder abduction. So first, We'll perform the PROM on patient to determine the end field. So here's the end field, and put it back to the original position. To align the goniometer, we have to palpate the bony landmark for shoulder abduction. So it's same as the shoulder abduction. The axis will be at the anterior aspect of acromion. The stationary arm will be parallel to the sternum, and the moving arm will be at the anterior midline of humerus toward the medial epicondyl of humerus. So now, sir, I might have you to perform the action just now by yourself. I will stabilize your shoulder to prevent lateral trunk flexion. Okay, sir, can relax. So the reading will be at 36 degree, which is not within the normal range of motion 0 to 45 degree. So now we'll proceed to the shoulder internal rotation. And before we start, have the patient in supine lying position, and we have to perform PROM on the patient to determine the end field. When the patient is supine lying position, you have to ask the patient to abduct the shoulder to 90 degrees and flex the elbow to 90 degrees with the forearm pronated. So we'll place a towel here. Your arm, I have you to move your arm to the edge of the bed with the elbow flex. Is that position comfortable for you? So here's the end field of internal rotation, and put it back to the original position. To align the goniometer, we have to palpate the bony landmarks for shoulder internal rotation. The axis of goniometer will be at the olecranon process of ulna. The stationary arm will be perpendicular to the floor, and the moving arm will be aligned to the ulnar border of forearm toward the ulnar stylet process. So can you please perform the action just now by yourself? I will stabilize your shoulder. Thank you, sir. You may relax. So the reading is 64 degree, which is within the normal range of motion 0 to 70 degree. Now we'll proceed to the shoulder external rotation. So now we'll perform PROM on the patient to determine the end field. So here's the end field, and we put it back to the original position. The alignment of goniometer is same as shoulder internal rotation. So now, sir, can you please perform the action just now by yourself? I will stabilize your shoulder. Okay, so you can relax. So the reading will be around 84 degree, which is within the normal range of motion 0 to 90 degree.
Hi sir, my name is Alia Ardini. I'm the first year physiotherapy student from UKM. So for now, I'm going to take over for the shoulder extension and also ROM on elbow area. So now we are going to proceed to the elbow extension and elbow flexion. For elbow flexion, the patient starting position in supine lying position. Sir, do you comfortable in this position? And for the forearm is supinated. Okay. So I will do the PROM first to determine the end field. So I will stabilize the humerus and make sure the forearm is supinated. Okay. And next, I will align the goniometer. The axis is at the lateral epicondyle of the humerus. Yes. And the stationary arm is the lateral midline of humerus toward the acromion, and the moving arm is the lateral midline of the radius toward the radius stylo process. So, sir, can you please repeat back the motion by yourself? Okay, now I'm going to palpate the landmark back. So for the reading is 141. That is within the normal range. That is 0 to 145. For the elbow extension, the starting position are the same. The patient is supine lying position. Right? A towel underneath the arm at the proximal part. And we are going to directly align the goniometer. So the alignment of the goniometer are the same. So I'm just going to palpate the landmark sini. So as we can see, the reading of the goniometer are at the 0 degree, so it is within the normal range. So now I'm going to put the P or M to determine the angle. So I'm going to okay. So now for the alignment of the goniometer, the axis is at the midpoint of the lateral aspect of the acromion. The stationary arm is the lateral midline of the thorax. The moving arm is the lateral aspect of the humerus toward the lateral epicondyle of the humerus. So I'm going to stabilize the scapula. And sir, can you repeat the movement back?
Yes.
So I'm going to take the reading. And it is 40 degree within the normal range of 0 to 60 degree. So sir, can you position yourself to sitting position? And you can wear the clothes back. So for arm supination and pronation, I need you to sit on the chair and place your arm on the chair. So I will put towel underneath your arm. So are you feel comfortable in this position? So I'm going to do PRM first to determine the angle. So I'm going to stabilize the distal humerus. Okay. So for the alignment of the goniometer, the axis is at the volar surface of the wrist, aligned with the ulnar stylo process. The stationary arm is parallel to the anterior midline of the humerus, and the moving arm is on the volar surface of wrist, a level to the ulnar stylo process. So sir, can you repeat the motion back?
Yes.
撑着10秒，然后站起来，可以吗？啊，可以。好，那可以看自己哦。
So the reading is 90 degree.
OK。
That is within the normal range of 0 to 90 degree. So for arm pronation, I will first do the PRM to determine the
要不
angle,
你这不是就可以了 OK， 看一下。对了，1、
and I will stabilize the distal humerus.
6、7。
Okay. Align the goniometer. The axis is in line with the ulnar stylo process. The stationary arm is parallel with anterior midline of the humerus, and the moving arm is the dorsum of forearm. I will start the measurement. Sir, can you please do the movement back? Okay. So the measurement is 85 degree. That is within the normal range of 0 to 85 degree. Sir, thank you for your cooperation for the measurement. That's all for today.